So what do we do for clients with a suspected UTI? First, collect a urine sample for urinalysis and culture. The urinalysis analyzes urine for the presence of infection like nitrates and WBCs. The urine culture and sensitivity identifies specific organisms and antibiotic sensitivity. But to get accurate results, we must be careful when collecting the urine specimen. Remember, the clean catch urine specimen should be collected in the middle of the urine stream or midstream after the client initiates urination. And here's an important tip you must remember for NCLEX. Always collect cultures before administering antibiotics. Otherwise, the antibiotics will be present in the urine and no bacteria will grow. We should also anticipate antibiotic administration and instruct the client to complete the full course of antibiotics. They should never stop early. And finally, monitor for symptoms of pyelonephritis like flank pain, which indicates the infection is moving to the kidneys. So remember for NCLEX, we must teach clients with UTIs to hydrate to eradicate. They should aim for at least 2 liters of fluid a day and instruct the client to never hold in the urine, even if it burns. They should urinate often and don't delay to keep the bladder empty and flush out the bacteria. So now let's talk irritants. No alcohol, caffeine, or spicy foods. So tell the client to say goodbye to cocktails, coffee, and curry. And remember, UTIs hurt, so we give phenazopyridine, a urinary analgesic, to reduce discomfort. And finally, implement comfort measures like warm sitz baths and heating pads to decrease pain. Now it's time for our next NCLEX quick check. So let's pause and answer these questions. When should the container be placed into the urine stream during a clean catch specimen? That's midstream. Should a urine culture be collected before or after antibiotics? Before. How much fluid should a client with a UTI consume daily? At least 2 liters. And finally, which bladder irritants should clients with UTIs avoid? They should avoid alcohol, caffeine, and spicy foods. So once again, no cocktails, coffee, or curry.